This is Jerry Hesch, a physical therapist and orthopedic manual therapist, meaning that I treat joints, and I'm from Hesch Institute in Aurora, Colorado. I treat patients with sacroiliac joint dysfunction, have added to the development of evaluation and treatment of the joint, have published a book and several book chapters on the topic, and have taught more than 100 workshops on evaluation and treatment of sacroiliac joint dysfunction. This presentation is on treating symmetrical patterns of sacral mobility dysfunction. You can have a sacrum that is stuck in forward bending, and motion will be blocked when you spring the back of the sacrum. And that can be restored manually by gliding the sacrum downward and also pushing it backwards. That can also be treated by placing the person on 2" by 4" by 8" foam under the lower part of the sacrum with the hips and knees flexed at 90 degrees, but it takes 5 minutes. It does not respond to quick adjusting forces. It's a very dense joint, and it takes 5 minutes to get it to move through the entire part of its range. A sacrum that's stuck in backward bending, in which there's lower sacral mobility, but there's no motion at the top of the sacrum, is treated by placing the person up prone on their elbows so they get some curve in their lumbar spine. And it's a manual correction with the heel of the hand on the upper sacrum. It's a very gentle amount of force taking up the slack in the joint and maintaining steady pressure there for 5 minutes. Another symmetrical pattern of the sacrum is one in which there is a lack of inferior glide of the sacrum, and that involves the lumbosacral facets. And to treat that, it's a manual treatment, and you place pillows under the lumbar spine to flex that lumbosacral joint, and then there's a manual contact applied on the sacrum in an inferior direction for 5 minutes. The other is a pattern I discovered called posterior glide fixation of the sacrum, in which the sacrum is wedged posteriorly and stuck, and there's no passive movement anywhere throughout the pelvis. The SI joint is stuck on both sides. And for that pattern, we treat it by putting foam under each side of the sacrum, of the ilium. We do that for 5 minutes, and then we leave it there for an additional 5 minutes, and then the therapist just simply pushes anteriorly on the sacrum, and that takes 5 minutes. Does not respond to a thrust manipulation. It's a very, very dense joint, and it's very, very stuck, and it requires an anterior pressure at the S1, S2, and S3 levels, because that's where the joint is formed at the upper 3 sacral segments, and that force needs to be maintained for 5 minutes. And we often think that sacroiliac joint dysfunction requires an asymmetry, but these are a couple of examples where the pelvic structure is symmetrical, but there's still a loss of motion in the sacroiliac joint. It's tested with passive manual forces called spring tests, and these can be treated manually, and a couple of them can be treated passively with positioning on foam. I hope this is informative. Thank you.